Well, thanks for staying with us here on Sunrise. We are in the month of November, so we are talking men's health, and your risk of developing prostate cancer increases with age, but that doesn't mean it's a disease that only affects old men. Prostate cancer is the second most common cancer in men worldwide. According to research, men experience worse longer-term health than women and die on average 6 years earlier. It also indicates that prostate cancer rates will double in the next 15 years. To talk more on this, we are joined this morning by Dr. Kalli Spencer, who is a urologist for Movember, as well as Dr. Thabani Nkwanyana, a healthcare practitioner. You at home can be a part of the conversation by calling us. We're on 011-447-1742 or 1620. You can also comment on our Facebook and Twitter pages. Doctors, I should say, thank you so much for joining us this morning. Now, obviously, you know, when it comes to men's health and speaking about men going and having themselves checked out, it's always a difficult conversation because men, you know, feel they have to be macho. They have to, they can't appear weak in any way, I should say. But that's something we have to debunk, and it's not a sign of weakness. Dr. Kalli, maybe if I can start with you.
Yeah, I mean, it's totally true. Men present late, we know it, and unfortunately often their conditions are advanced, you know, and which makes treatment options a lot more difficult. So that's why we have these campaigns, you know, that's why Movember is trying to get conversations going amongst men to start talking and getting to go and encourage them to get themselves checked, examining themselves, you know, examining their testicles to see when something changes, go and see the doctor, get your prostate checked after the age of 40. That's the benefit of doing this campaign and having these discussions.
We know when men get together, there's generally, as sport is the biggest thing. We talk football, we talk all kinds of things, we talk about the ladies. Do we talk enough about, and how do we change that? How can we, you know, just change that perception that it is something that men can be open about?
Yeah, I think men in general need to change their health-seeking behavior. And I mean, they shouldn't be really scared about physical examination. And the nice thing, or the good news, is that a lot has changed, and now we actually have a blood test that can be done. Because I think most men dreaded the finger or the digital rectal examination, which then for them caused a lot of anxiety to go to a doctor and have a finger inserted on your behind. So I think it's a good news that there's now a test that you can do, and it can be screened at any age, especially men over the age of 40. Because we know now that even younger men are starting to be affected by the prostate cancer. So it's
starting to present.
Yeah.
Okay.
Yeah.
So tell us a bit about the test. I mean, you know, for those men who feel, you know, when they hear about the test, you hear prostate, immediately your mind goes racing. Well, what does the test involve?
I have to correct Thabani, we do still, as urologists, like to do the rectal exam because the combination of the test and the PSA together will give us the most information and it gives the most accurate diagnosis. But it's really literally a 5-second thing. It's not painful, it's quick, you know. The PSA test, as you said, is a simple blood test, which, you know, takes a few seconds as well. And that will give us the most amount of information. Yeah.
And it's a simple test, like you said, it's not invasive in any way, and men shouldn't be afraid of it.
Not at all.
Technically, they shouldn't be afraid.
If you think of not doing the test and the possible complications of having a prostate cancer that's undiagnosed, you know, it's just a small little needle prick is really not a lot to ask.
Yeah. Now, when we speak about, you know, actually testing yourself and maybe checking your own testes, and, you know, what kind of tests can men do to kind of, you know, we know with women they do with the lumps, you check for lumps and all that kind of thing. What kind of tests can men do just to check themselves, I guess?
Well, for other cancers, maybe like testicular cancer, you can do self-examination where you can palpate your testes. But if you think about the prostate, it's quite deep-seated. So there's really no way, because it's deep-seated in the pelvis, just below the bladder and just in front of the rectum. So it's not really reachable for you to be able to do a self-examination test. So that's what then makes it more imperative that you actually see your doctor.
So you have to go and see your doctor?
Yes, but there's many reasons why you should. As people who have family history of cancer, they should at least screen more frequently, or maybe where there's a family history, or maybe there's other issues that you think you might have a risk for, high risk for cancer, you should first.
But, I mean, you should go and see your doctor anyway, because when you start approaching 40, I mean, there's other diseases, high blood pressure, you would know from insurance, high blood pressure, diabetes, all these things can be picked up. You know, erectile dysfunction is an early marker of the risk of cardiovascular disease and having a heart attack. Often the erectile dysfunction comes first. Okay. So if you're experiencing that, you should seek help. It depends where the position is of the testicle. So, I mean, if it's still sitting in the scrotum, it should be okay. It's when it starts sitting sort of in the groin or it's hidden in the abdomen, then an operation is recommended because there is a risk of testicular cancer. But if it's sitting within the scrotum, and even if it's higher up, it's still okay. So it depends on where the position is. But your urologist would examine you, maybe send you for an ultrasound. So it's hard to say without seeing you in person.
But obviously, with him having been examined, do you think it is clear if the doctors have said he should be fine, then should have?
Well, that's what I'm thinking. Maybe if it is still within the scrotum, you know, then they probably think it's okay. It's when, as I said, it's in the groin or inside the abdomen, you know, that's when we're concerned, and you should think of having a surgery to bring them down.
Okay. Obviously, you know, going into this month of November, it's about men's health, and men need to be more cognizant of what they do and how they take care of themselves. What are some of the things that men should be aware of, that, you know, just to take better care of themselves? I know you said going and seeing your doctor should be a regular occurrence.
I think the other thing that you need to focus also is lifestyle changes. There is studies that show that there is certain diets that can promote cancer or have carcinogenic effects. That's your diet, like your Western diet, where there's high fat and lots of processed foods. So we encourage people to at least maybe look after what they eat, more fresh fruits and vegetables. So it's more lifestyle, and regular exercise also helps. So I think we have to also transform just from maybe looking at health as a disease, but also looking at health as a lifestyle modifications that we can do, that we have control of doing. Things like familial and genetic problems, we may not have control of that, but there's a lot of lifestyle changes that you can make to make things better.
So live a better life, basically. Yeah. I just want to know, with men, there was a question that was raised whether, you know, seeing a woman, a female doctor or a male doctor, is that something that comes up very often, where men are uncomfortable seeing a female doctor for such problems?
I've never really heard from my colleagues, female colleagues, that that's ever been a problem. Very rare scenarios, once or twice, but generally men seem to be comfortable. There are female urologists and they do see male patients.
So just quickly in wrapping, the Movember campaign, what should people know in terms of Movember?
Right. So they need to go and visit. There's lots of different ways to, there's the website, za.movember.com. There's on Twitter, Movember RSA, and there's Facebook. And basically they need to sign up, they need to grow a moustache. As we know, Movember's the month, 30 days to grow a moustache. You can join an event, host an event, form a team, raise money. Thabani had mentioned exercise, so there's a big push, it's called Move. As part of Movember, Move. Also to reach your personal best. Or to form a team and to do some races, and then also, like the caller said, there's Mo's sister, which can adopt a Mo bro, and they can encourage them and also create some discussions or sponsor them and get some funds. But it's all explained very nicely on the website. There's a very user-friendly website which explains it all.